I first learned about Dr. Dumitrescu from my neurosurgeon. I went to a renowned neurosurgeon because I was having problems in my neck. And he first prescribed physical therapy, anti-inflammatories, and after several months they didn't work, and he recommended fusion. I asked him if there were any options, and he said that we could try injections, and he recommended Dr. D. I came to Dr. D. He concurred that that might be a good option, and I received an injection from him. When I came to him, I had no lateral movement ability in my neck, and I had complete relief. I'm pain-free, and so avoided fusion completely. I also, since I was a very young woman, have had problems with my knees. They're just congenitally not right, and I skied and snow skied, water skied, ran. I climbed a mountain, 14,000-foot mountain, about 4 years ago, and I went to my orthopedic surgeon. He said, we have to do surgery, and he said, actually I would recommend knee replacement. So I asked the doctor if I had any other options, and he told me about a relatively new technique that was called platelet-rich plasma. And Dr. D said, you know, it looks like your body takes to this PRP very well, responds to it well. I also had some problems with arthritis in my thumb and my wrist, to the point where I couldn't lift anymore, that I had spontaneous pain, I couldn't sleep at night. And he said, while we're doing your knee, we will inject your wrist and your thumb as well. And so he did. And I had immediate relief in both areas. He recommended that I do 3 procedures. And so I came back the next time, and about a month later, and I had the PRP plus a second procedure called intraosseosis, where he actually injected it into the bone of the knee. And he injected my thumb and wrist. And I came back a month later, and I had the PRP plus the intraosseosis plus a procedure called AZM. And this was a procedure that he said was fairly new. They've been doing it in Europe for quite some time, but in the United States not so long, but with really good results. And because I have a torn meniscus and I have bone on bone with my knee, that he recommended that we do this procedure because this procedure has known to rebuild cartilage. And so we did this procedure, injected my wrist and my thumb again, and I came back for my follow-up treatment about 6 weeks ago, and I'm totally pain-free with my wrist, my thumb, and my knee.